Hello, and welcome to our pitch day talk on improving mental health treatment using real-time assessment of behaviors and emotions. My name is David Lindenbach, and I'm presenting here on behalf of the study team. We believe that this pitch is especially timely and relevant, just given how the COVID-19 pandemic and the public health measures meant to curtail the spread of the virus have had a negative impact on the mental health of so many people around the world. The problem that we're trying to solve is that tracking mental health is hard. So if you look at clinical trials that examine new mental health treatments, typically the assessments, they're done infrequently and they're subject to recall bias. So if you enroll in one of these trials, what you could expect is that every few weeks or even every few months, you might come in and answer a series of surveys about the anxiety that you've been experiencing, your level of mood, your depression symptoms, but you'll be asked to recall sort of the average of how this was over the last few weeks or few months. Now, as everyone I think knows, mental health can be pretty dynamic. Some days are better than others, and so it's very difficult to accurately assess mental health when you're relying on retrospective recall over a very long period of time. This is especially problematic for a group of mental health interventions, which we call skills-based psychotherapy programs. So basically, this is a type of program where you're taught a series of coping strategies and skills that you can use to help you deal with difficult emotions. And one of the programs that our team is currently investigating is called the Unified Protocol for the Transdiagnostic Treatment of Emotional Disorders in Children and Adolescents. This is a very long name, which is why we abbreviate it to do Unified Protocol or simply UP. So as I mentioned, these programs require people to practice coping skills, and it's expected that probably people who practice these skills more are going to experience a greater degree of clinical benefit. The problem is it's very difficult to actually properly assess that because it's very difficult to know if people are actually practicing these skills regularly, especially if you're just talking to them every few weeks or few months. So the solution that we have in mind is to use real-time monitoring with a mobile app. So the idea would be that you create a mobile app that would track two things. The first is use of skills in the UP workbook. So this is a published manual that exists. It is a physical thing that you can buy on the Amazon store if you want. And so we have a discrete set of skills that people are supposed to be practicing, but it's difficult to actually get them to record whether or not they're practicing these skills. People will often use them, but they don't record them because you don't have the workbook around. It's a bit of a pain to go grab the workbook. But the nice part about a mobile app is you always have your mobile app. You always have your mobile phone with you, right? So this is a key advantage of turning a physical book into a mobile app. Second thing that the mobile app needs to test is mental health status, right? So this has been done before. So there's, for instance, the Mood Buster app, which is led by a team out of Europe, and it's basically just tracking people's mental health over a period of time. So this has been done before. The key innovation here is that we're fusing these two ideas. We're taking skills that exist in a physical workbook and we're making that into a mobile app that also tracks mental health status. And the idea is that this will allow us to assess the extent to which actually using these UP skills, using the skills that are in the workbook, lead to clinical benefit. Now, while our team is interested currently in testing the UP app, once proof of concept has been established, the mobile app could really be used to test a lot of other interventions. As far as the benefits of collaboration, so first is that you really have the opportunity to gain a lot of valuable skills in mobile app development. Mobile apps is the space that's really hot right now. A lot of employers are looking for people with skills in mobile apps. And as well, you have the opportunity to really be at the vanguard of innovations in mental health. This is really cutting edge work that we're doing here with the Unified Protocol. So there's a lot of opportunities, and then of course potential for authorship on publications. So we have a really great team of mental health researchers, and we're just looking for some people who have technical skills with mobile app development. So if that sounds like you, please do let us know, and thank you very much for your time.